So the bastis are a big chunk of Ayurvedic medication. And I have to admit, in the first few years, me and my patients, we were a bit like doubtful, suspicious. We were not really comfortable with just applying enemas. But I have to say, over the times, just seeing the benefit, and also seeing that the patients are just not that much fuzzy about. So I developed just certain strategies. And so one is, you really grab the side of the bottom and ask the patient to really lift it a bit higher and show the entrance themselves. So this is really nice because you don't feel like, oh my God, I'm so embarrassed. I'm kind of like poking around. They lift, they show you the entrance. You just put the entrance part in a little bit of ghee. You ask them to say ghee, and with the word of ghee, then the anus relaxes and you can just easily, smoothly move in. So far, I had not a single problem that anyone was just resisting and saying, oh no, this is gross and I can't relax, because it's just really a very smooth method. And it's much easier than the oil enema with a basti bucket, which is a bit trickly and frickly. So, you never feel so good because you have an enormous amount. And the Nirua basti, the water basti, has been going to be expelled very quickly. So the patient sometimes, when you're still filling it in, they get nervous because they feel like they have to run. They should just try and keep it in for a moment. While the oil basti, the oil enema, is always done after the meal, in the evening, and then just before bedtime, so it can stay overnight and really work as good as possible. Then we have very rarely substances that we move up through the urethra. We hardly don't do that. It is a yogic technique that we use for sexual control mostly. Sometimes in case of cancer as well, we would use it, but the high risk of infection of the bladder by also causing little injuries is just not in relation, so that we would hardly use that on a regular basis. The next one is then vaginal application. And for instance, there's a beautiful oil, which is called the Sahasrara oil, which I totally love. It cleans also the pathways, the birth channel, if a woman is about to give birth. And there are sometimes vaginal infections that might even cause early contraction of the uterus. So the Sahasrara oil is a beautiful oil. You can use it as a suppository. Then I use the Jatyari oil for chronic fungus, candida infection, and also for HPV, the little warts, the genital warts that are infectious disease, also to reduce them and the risk of developing cancer. One method for people who have developed these warts is something that most people don't associate with Ayurveda straight away. It's an operation, and we do have surgery in Ayurveda. As you know, it's from the Sushruta Samhita. It's a different book. And in the Sushruta Samhita, we learn that we would actually use a thread of gold and heat that up and then burn the genital warts. So Ayurveda does know a lot of surgery, in fact. And the key sentence is that dead material has to be removed from the body always. It's just like the rule. We have a problem sometimes with Western patients who just stick on to that material in their body for some reason, like their tonsils, and they just don't want to let go of it. In Ayurveda, we always say this has to be removed because the toxic side effect is so high. And when we talk about toxins, dead cells are toxins, okay? So the other things that people often consider as toxins, I have to do a liver detox. This is not an Ayurvedic concept at all. But dead cells produce toxins because they are decaying, and they always give that information to more healthy cells. So these vaginal suppositories or vaginal oil applications are very popular. Something is now coming up these days, which we are all a bit skeptical about. This is something that people say it has been an Ayurvedic method, but I couldn't actually find any reference that some kind of a steaming, and any proper gynecologist will tell you, no, a vagina doesn't need to be steamed. A vagina is a clean thing, and it doesn't need to be just treated like a dumpling, because it's more likely to develop than fungus, as if it's kept nice and dry. It gets moist by itself, you know. Particularly also the steaming, mostly the temperature is too high, so you burn the very delicate tissue. Just don't do it. And then we also have the application via the skin. We talked about this in the sense of abhyanga. So any material like lepa or kalka or abhyanga will just be absorbed into the system by the rajaka pitta. So you just benefit from the herbal application, not only on the area where it is applied, but also for your internal organs. So it's a wonderful method. It's just very sensual. It is very caring. It just builds a strong connection between you and the patient. I think it's the most wonderful way to introduce people to Ayurveda. This is the way how we give medication to the people via oil massage. Then we also have the way that medications are injected, but in our normal case, we hardly do that. I basically use injection only with a little bit of mineralized water in case of trigger point treatment, but in general, it's not classic Ayurvedic to use injections. Again, it's a problem. As you can see from the old days, they probably don't have clean syringes. In our case, we would have, but it's not really what we need to do, particularly not when we start with Ayurveda. So just stick to your little pharmacy. I'm going to introduce you in the next lecture then, and just try and play around with it and see the different ways you can applicate certain herbs, and always just try it out. It's the key. Your own life experience is the key to treat the patient with their experiences. You have to meet the patient and make a connection, and the connection through experience. That doesn't mean that you have to face all the terrible times in life that the patient has, but it means that you are open to experience. You're not closing yourself off from the world just because you practice Ayurveda. In fact, the more open you are, the more curious you are to the world, the better practitioner you will become, because you're embracing the wholeness. Always think of Ayurveda as a whole, as a spiritual, as a connection to everything that is between the beginning and between the end. This is the pathway of Ayurveda. That's the real meaning of Ayurveda. That is from the beginning to the death, the science. It is not only the science of life, because life just seems to be in our culture a bit just hesitating talk about death. No, Ayurveda also embraces death. So I wish you a very happy day. I wish you a very happy time and just a wonderful life. Hari Om.